Hi friends, welcome to Fast Coder 21. Today we are going to learn one of the most important ICD-10 CM chapter 13, diseases of the musculoskeletal system and connective tissue. General conditions or common conditions we will find in chapter 13 are osteoarthritis, osteoporosis and rheumatoid arthritis. So we have first guideline, site and laterality. So most of the codes within chapter 13 have site and laterality designation. So for example, if you want to code fractures or any type of pathologic condition, we need to check site and laterality of the conditions. The site represents bone, joint or the muscle involved. So bone means, for example, if you take any bone, we have upper end, lower end, shaft. So we need to find the site of the bone where the fracture or injury occurred. So for some conditions where more than one joint or muscle is usually involved, such as osteoarthritis, there is a multiple sites code available. So for example, multiple sites has the osteoporosis, where we have multiple sites code is available in ICD-10 CM. So for example, if you don't have multiple sites code in the ICD-10 CM, we need to code individual codes. Means we need to code multiple codes in order to satisfy the condition. Next, we need to nail bone versus joint. So what happened for certain conditions, the bone may be affected at the upper or lower end. Though the portion of the bone affected may be at the joint, the site designation will be the bone, not the joint. So when you hear the main thing is when you refer bone, when you refer joint. So whenever there is a problem with the bone, we need to code the bone as the site, not as a joint, even though the condition is near to the joint. So we have an example here. The patient is admitted for evaluated for left hip replacement surgery because of idiopathic avascular necrosis of the left hip. So how do we code? M87.052. Next guideline, acute traumatic versus chronic or recurrent musculoskeletal conditions. So many musculoskeletal conditions are a result of previous injury or trauma to a site or recurrent conditions. So most of the musculoskeletal conditions are because of previous injury, trauma to a site or recurrent condition. So because of previous injury, we may have musculoskeletal condition. Because of trauma to a site, we may have musculoskeletal condition, or because of recurrent conditions. So bone, joint or muscle conditions that are result of heel injury are usually found in chapter 13. So whenever there is a healing of or healed bone, joint, muscle conditions, we need to find in chapter 13. Next, recurrent bone, joint or muscle conditions are also usually found in chapter 13. So recurrent means they will occur again. So next, any current acute injury should be coded to the appropriate injury code from chapter 19. As all of us know, whenever there is a current injury or trauma, we need to code from chapter 19. Chronic or recurrent condition should generally be coded with a code from chapter 13. So if we have chronic conditions or recurrent conditions, we need to code from chapter 13. If it is difficult to determine from the documentation in the record which code is best to describe a condition, query the provider. So whenever there is a conflict in the documentation, we need to query the provider regarding the specificity or the site. So basically, what is the motto of this para is chronic or recurrent conditions, we need to code from chapter 13. So if we have current injury or acute injury, we need to code from chapter 19. So here we have an example. The patient was seen in the ER for recurrent dislocation of left finger, M24.445. As based on our guideline, we need to code recurrent conditions from chapter 13. So here we have coded M24.445 for recurrent dislocation of left little finger. Next guideline, coding of pathologic fractures. So seventh character A is for use as long as the patient is receiving active treatment for the fracture. So we need to code seventh character A as long as the patient will receive active treatment. So active treatment means the fracture is not reduced or repair is not performed. He is coming for initial treatment for the fracture, which usually we'll call it as active treatment. So while the patient may be seen by a new or different provider over the course of treatment for a pathologic fracture, assignment of the seventh code or seventh character is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. So whenever we have a documentation in order to code pathologic fracture, we need to code whether patient is undergoing active treatment or subsequent treatment. So active treatment means patient is undergoing the treatment for the first time. So it is not healed, he is undergoing the treatment. So active treatment is not depend on the whether physician is seeing the patient first time or second time. Even though patient has the active condition, if the different physician sees the patient, we need to code it as active condition, not subsequent condition. So seventh character D is to be used for encounters after the patient has completed active treatment for the fracture and is receiving routine care for the fracture during the healing or recovery phase. So what happens in character D? So when there is a complete recovery from the current injury or fracture, we need to code it as a seventh character D, which is subsequent encounter. So whenever patient visits the physician for during the healing phase, we need to code chapter character D as a seventh character. So the other seventh characters listed under each subcategory in the tabular list are to be used for subsequent encounters for treatment of problems associated with healing such as malunions, non-unions and sequelae. So based on the tabular list, we need to code non-unions, malunions and sequelae. Next one. Care for complications of surgical treatment for fracture repairs during the healing or recovery phase should be coded with the appropriate complication codes. So what is this guideline? If there is a complication related to fracture repair during the healing or recovery phase, we need to code it as a complication, not active treatment. So here we have one guideline. The patient was seen for follow-up after vertebroplasty for pathologic fracture of the L1 vertebra, which is healing. Patient has osteoporosis of vertebrae. So here our code is M80.08 into D. As based on guidelines, if the patient has fracture which is healing at the current session, we need to code it as seventh character D. So based on guidelines, we have coded here M80.08 into D as the documentation tells the pathologic fracture of the vertebra is healing. Next guideline, osteoporosis. What is meant by osteoporosis? Osteoporosis is a systemic condition and meaning that all bones of the musculoskeletal system are affected. So it is basically systemic condition. Anywhere we can get the osteoporosis. Therefore, site is not a component of the course under M81 osteoporosis without current pathologic fracture. So the site codes under M80 osteoporosis with current pathologic fracture identify the site of the fracture, not the osteoporosis. So for example, if you take M80 series codes, which denotes site of the osteoporosis, not the osteoporosis. So osteoporosis without pathologic fracture. Category M81 osteoporosis without current pathologic fracture is for use for patients with osteoporosis who do not currently have any pathologic fracture due to osteoporosis, even if they had fracture in the past. So basically, when do you code osteoporosis without pathologic fracture? So patient has the osteoporosis, but there is no fracture in the documentation or the current condition. So whenever there is no fracture associated with osteoporosis, we need to code the M81 series code, osteoporosis without pathologic fracture. Even though patient had previous fracture, we need to code it as M81 series code. So for patients with a history of osteoporosis fracture, we need to code Z87.310, or healed osteoporosis fracture, we need to code M81. So we have an example here. The patient underwent a percutaneous vertebroplasty for pathologic fracture of the L1 vertebra due to delayed healing. So patient has osteoporosis of vertebrae. We need to code M80 series. Here our example contains osteoporosis of vertebrae. So it is site located. So it is a pathologic fracture. So we need to code M80 series code. Next one, osteoporosis with current pathologic fracture. So how do you code current pathologic fracture? We need to use the M80 series code. So here we need to understand osteoporosis without pathologic fracture. We need to code M81 series, and osteoporosis with current pathologic fracture, we need to code M80 series. Next guideline, multi-system inflammatory syndrome. So for individuals with multi-system inflammatory syndrome and COVID-19, assign code U07.1 COVID-19 as the principal first stage diagnosis, and assign code M35.81 multi-system inflammatory syndrome as an additional diagnosis. So anyway, now it is COVID is reduced. So you can read this para or guideline self-explanatory, or you can read it easily. Thank you guys. Thanks for watching Passcoder 21. Please like, comment, share, and learn from our sessions.